Hello students, welcome to Periodontics Week 1, Chapter 1 through 4, Part 5. Introduction to Disease Classification. A classification is a systematic arrangement into groups or categories based on common attributes. There are two major categories of periodontal disease, gingivitis and periodontitis. It is important to understand that the terms periodontal disease and periodontitis are not identical in their meaning and are not interchangeable in their use. If the periodontal disease infection is limited to gingival tissues, it is called gingivitis. If the infection involves all structures of the periodontium, it is called periodontitis. The illustration on the lower right shows a decision tree which is used to decide what category or classification to use. The first question, is there inflammation? If the answer is no, then we have health. If their answer is yes, then we need to ask, is there a loss of attachment? If not, it is gingivitis. If there is loss of attachment, it is periodontitis. Loss of attachment is the hallmark of periodontitis. A periodontal classification system provides information necessary in communicating clinical findings accurately, presenting information to the patient, formulating individualized treatment plans, and predicting treatment outcomes. In gingivitis, the tissue is red or bluish red. It is swollen with rounded margins. It is bulbous or has swollen papillae. There is bleeding upon gentle probing. Probing depths are greater than 3 millimeters because of swelling. There is no apical migration of the junctional epithelium, and there is no bone loss. In periodontitis, the tissue is purplish, red, or pale pink in color. It is swollen or fibrotic at the margin. The papillae do not fill the embrasure spaces. There is bleeding upon gentle probing. There may be pus. The probing depths are greater than 4 millimeters because of apical migration of the junctional epithelium. There is bone loss. Attachment loss is the hallmark of periodontitis. The migration of the attachment apparatus apical to the level of the CEJ due to the destruction of the fibers and bone that support the teeth. Table 4-1 on page 70 shows the 1989 classification of periodontal diseases. In 1999, an international workshop adopted a new classification system for periodontal diseases and conditions. This classification was adopted by the American Academy of Periodontology. When reading the dental literature, you may come across unfamiliar names for periodontal diseases. These most likely are from the 1989 classification of periodontal diseases. You may need to refer to this older classification in order to determine the current terminology for the disease. See Table 4-2 on page 71 for a listing of the 1999 classifications. Type 1 includes gingival diseases that are either plaque-induced or non-plaque-induced. The plaque-induced include caused solely by plaque, modified by systemic factors, modified by medications, modified by malnutrition. The non-plaque-induced include of bacterial origin, of viral origin, of fungal origin, of genetic origin, modified by systemic conditions, traumatic lesions, foreign body reactions, and not otherwise specified. Type 2 includes localized or generalized chronic periodontitis, Type 3 is aggressive periodontitis, both localized and generalized. Type 4 is manifestations of systemic disease, such as blood or genetic factors. Type 5 is necrotizing periodontal diseases, such as NUG and NUP. Type 6 are associated with endodontic lesions, or Perio lesions. Type 7 are developmental or acquired deformities or conditions, and Type 8 are abscesses of the periodontium. Chronic periodontitis is the most common form of periodontitis. It is a bacterial infection within the supporting tissues of the teeth. The disease is characterized by destruction of the periodontal ligament fibers and alveolar bone, and by pocket formation and/or recession of gingival margins. This type of periodontitis was previously known as adult periodontitis because it was once believed to be primarily found in adults. Epidemiologic data, however, indicates that chronic periodontitis can be found in children as well as adolescents. Chronic periodontitis is initiated and sustained by plaque biofilms. However, the body's host response to the bacterial pathogens is responsible for most of the tissue destruction seen in chronic periodontitis. The disease usually progresses at a slow to moderate rate, but there may be short periods of rapid disease progression. Bacterial plaque and subgingival calculus are frequent findings. The disease can be modified by and/or associated with systemic disease. Other factors such as smoking can be predisposing factors. Aggressive periodontitis is a bacterial infection characterized by a rapid loss of attachment and a less predictable response to periodontal therapy than chronic periodontitis. The disease may be localized or generalized. Aggressive periodontitis is much less common than chronic periodontitis and may occur in the primary and adult dentitions. Aggressive periodontitis differs from chronic periodontitis in several characteristics. A rapid rate of disease progression that is seen in an otherwise healthy individual that results in rapid attachment loss and bone destruction. The amount of tissue destruction may be inconsistent with the presence of local etiologic factors. In other words, there may be relatively small amounts of plaque biofilm or calculus deposits. There is usually a family history of aggressive periodontitis, and the disease can be modified by and/or associated with immune deficiencies and other genetic factors. Recent research has found a strong link between aggressive periodontitis and the host response. Periodontitis as a manifestation of systemic disease is the disease category used when the systemic condition is the major predisposing factor and the bacterial infection is considered a secondary feature of the systemic state. This periodontal disease is associated with systemic conditions in which there is a significant reduction in the number of neutrophils or impairment in the ability of the neutrophils to fight infection. A severely decreased hose resistance associated with a systemic condition is the major etiologic factor in the development of this category of periodontal disease. Necrotizing periodontal diseases are a unique type of periodontal disease that involves tissue necrosis, which means localized tissue death. Clinical features include necrotic papillary and marginal gingiva covered by a yellowish or grayish coating, blunted or cratered papillae, spontaneous bleeding, fetid breath, and pain. A periodontal abscess is a localized collection of pus that forms in a circumscribed area of the periodontal tissue. Clinical features include localized gingival swelling, drainage of pus from the tissue, such as a sinus tract, pain on percussion or pressure with a finger, and increased tooth mobility. Periodontitis associated with endodontic lesions is a category of periodontal disease that involves infection or death of the tissues of the dental pulp. The clinical features include gingival inflammation, increased probing depths, loss of attachment, bleeding or pus evident on probing. Developmental or acquired deformities and conditions includes conditions that exist around the teeth that may predispose the periodontium to disease. Tooth-related factors include tooth position, root abnormalities, enamel pearls, defects in dental restorations, and occlusal trauma. Mucogingival deformities refer to defects in the normal shape of the gingiva and alveolar mucosa. This concludes our series of lectures for Week 1, Chapter 1 through 4. This has been Part 5.